Hello, my name is Dr. Kavian Milani. This is Medical Updates. Today the topic is going to be diabetes and the latest updates in the management of diabetes and especially the newer medications. The management of diabetes has been discussed in this program before. We had a couple of programs months ago and some programs since. However, the thing that I do want to talk about today are the latest medical updates on the diabetic medications. One thing that I do want to talk about, which is very important, is the issue of pre-diabetes. And this issue of pre-diabetes is one that really has occupied my focus and my time a lot. It is an issue that we have to deal with in our patient population, and it is kind of an essential way of managing diabetes. The pre-diabetic patient is a patient that has a fasting sugar of between 100 to 125, or a hemoglobin A1C of 5.7 to 6.4, and these patients are usually obese, insulin resistant, high triglyceride, low HDL, and they're moving towards diabetes fast. And they're increasingly at risk for heart disease, for stroke, for hypertension, for kidney disease, and for other ailments. One study that came out about 2 months ago that is very important and did give a significant insight into the management of the pre-diabetic condition. So people that had a BMI of 30 and below, and people that had a BMI of 27 but had a kind of comorbid condition like hyperlipidemia or high triglycerides or hypertension, were given a new class of medication in the form of injection called the GLP-1 medications. The GLP-1 medications are amazing, and they're kind of a newer generation of medications that are really have a particular way of managing diabetes, and there are a number of doctors locally that do use these a lot, and they do also cause a significant amount of weight loss and a potential reversal of diabetes. A number of months back, a study came out in 2016 showing that there was actually decreased mortality, decreased death on these medications. Remember that it's very difficult to prove death in medications. In diabetes, like insulin has been used for a long time, really has no data that it can prevent mortality. In fact, some argument has been made that actually can increase mortality. The whole class of oral hypoglycemic agents that are used a lot locally by physicians actually do tend to increase mortality and do have a black box warning to that effect. The other class of drugs that were out there, like the glutazones, they basically do not have any mortality benefit either, except for fixing the cosmetics of a sugar level or A1C. But the GLP class that I do want to talk about today, along with one other group of medications that are also kind of new, the SGLT2 class of medications, have been shown to be able to prevent mortality with an NNT that is very reasonable, of about 25. So you treat 25 people, you can actually prevent 1 case of death. And really that is an amazing development in the science of diabetes in the past 3 years. And so I do want to basically have patients, have people that have diabetes or family members that have diabetes to think about this particular issue. As you approach your medical provider, make sure you bring up these class of medications, because the doctors will be then very interested in pursuing that, and obviously an informed patient, an informed consumer always makes for a better doctor. The more informed the patients are, the more informed I feel I am, and I could basically then deliver better targeted medical care to that patient. So don't forget to ask about these classes of medication. This is Dr. Kavian Milani again. Thanks for watching Urgent Medical Updates. Please feel free to contact us at 703-383-4836 or by email at virginiamedicalupdates@gmail.com. And don't forget to like and share our video on YouTube, Facebook, and Twitter.